One of the biggest benefits to partnering with someone for managed Medicaid was access to data. And we had found through our managed Medicare work that because we're a small hospital, as you said earlier, most of us wear multiple hats, we're stretched. Having help collecting and then aggregating and also reporting that data has been a huge benefit to the organization.
Welcome to the Move to Value podcast. Today we're talking with Emily Volk, Director of Quality, Risk, and Compliance at Northern Regional Hospital, a small rural facility that's made a big name for itself in Medicare value-based care. Now they're taking that experience and applying it to the world of Medicaid managed care. From navigating limited resources to building powerful partnerships and reaching patients where they are, Emily shares how her team is improving outcomes and expanding access, all without losing sight of what matters most, patient care. Emily Volk, welcome to the Move to Value podcast.
Thank you. I appreciate the opportunity.
So Emily, can you tell me about your role at Northern?
Sure. In the almost 9 years that I've been here at Northern, I have been in the quality management department. So I started as an ACO care coordinator. That was my first title, and moved through several positions to now I serve as the Director of Quality, Risk, and Compliance. Our department is large. Well, it has a large responsibility. It has a small number of people. So we have responsibility over, of course, quality data collection and reporting, accreditation, and then ACO participation, of course, with everything that entails, like gap closure, cost monitoring, care coordination. And our department also includes the hospital's infection prevention program, as well as the medical staff office. So we have a really broad reach. I often say that quality management touches every part of our organization in one way or another.
That's great. I know that you wear a lot of hats. You guys do a lot of great work. You cover a lot of space, and you do it very well.
Thank you.
You recently, very recently, began offering Medicaid managed care. Can you paint a picture about the range of services offered and where care management sits within that ecosystem and how it supports the overall health of your patients?
Sure. And you're right. We're very early in this. We did, at the time we started managed Medicaid, we had partnered with CHESS for several years, but the CHESS Clinical Integrated Network was not yet set up for Medicaid. And so we began with participation in managed Medicaid with only two payer contracts, and we had one care coordinator for that entire population. So it was obviously unsustainable. One person cannot manage all those people. The other thing that was a little bit difficult is we're such a small hospital that we don't have, social workers. We don't have pharmacy consultants. We have pharmacists, but because they're heavily involved in, acute hospital care, it didn't really lend itself to managed Medicaid participation. And so the range of services that we were able to offer in the beginning was extremely narrow. Now that we are part of the CHESS Clinical Integrated Network for managed Medicaid, we have access to so many more resources. We have multiple care coordinators who are outreaching our patients. We have access to social work to help with transportation, food, housing insecurity, all of the, social barriers to care. We have access to pharmacy consultation, which is fantastic. That's something that is really, really valuable to our patients, not only to help them with cost, but also when there's medication changes, or if there's something that they are taking that could be optimized, switching to a different medicine, or, all of those different types of things, that really has helped us to increase the level of care coordination and access to care in that population.
That's great. I I do know that we do see a lot of success coming out of your team, and it's made everyone very happy, and I'm sure that it's made your patients delighted to know that their health is as a top priority. How did your work in value-based care lead to this next step of managed care, and what has that transition looked like operationally?
Well, when we first started to hear rumblings about managed Medicaid, we had been in partnership with CHESS for several years. We knew the value of the resources that we had utilized in managed Medicare. And so we reached out and said, are you guys going to start managed Medicaid? Because we really valued that partnership. One of the biggest benefits to partnering with someone for managed Medicaid was access to data. And we had found through our managed Medicare work that because we're a small hospital, as you said earlier, most of us wear multiple hats, we're stretched, having help collecting and then aggregating and also reporting that data has been a huge benefit to the organization. And then also having access to, we had experience with CHESS social work, we had experience with CHESS pharmacy team, and knew how beneficial that could be to our patients for accessing food pantries in our area, or transportation options, or getting their medications filled or delivered, in a way that could keep them on track with their health. So our really positive experience with CHESS in managed care or value-based care really pushed us toward them with managed Medicaid.
Well, since Medicaid's expanded in North Carolina, what changes have you seen in terms of access or patient volume?
We have seen an increase in our Medicaid population. It was kind of slow in the beginning, and we anticipated when we first had our rollout that we would see this huge, increase in Medicaid patients, but it didn't happen that way. But our payer mix really has seen a noticeable shift with Medicaid expansion. And we already had quite a large Medicaid population in our pediatric clinic, but we have seen the Medicaid enrollees come in through all of our practices and in our hospital as well.
Well, speaking of that population, how do you make sure care management works for patients who face the typical barriers, language barriers, culture? Some folks don't trust the healthcare system. Mm-hmm. Have you had any outreach efforts or changes that have helped?
Yeah, and I think there's two main, I guess I could call them pillars in our care management efforts. And really it bleeds into every part of patient care, I think. And those are communication and compassion. And our care coordination team is very good at communicating with our patients about the barriers that they're encountering, getting them access to care. Compassion, of course, plays a role in that, because when we feel compassion toward our patients, we can empathize with what they're going through. We work a little bit harder to help them, and we communicate a little bit better. And so because we're a small hospital in a rural community, we know a lot of our patients, or we know their families, or we have a family member who is in the same situation as they might be in. And so it's a little easier for us to understand what is or is not going to work for them. So I'm really proud of our care coordination team. We have a lot of good, strong, positive relationships with our patients. And that has really expanded into our CHESS team as well. So it's not just the care coordinators here at Northern, but because there's really good communication between the care coordinators and our providers, it really connects those patients to care and helps to work out some of the kinks in getting them access that they need.
Well, have you seen any challenges specific to Medicaid, or even access challenges overall that may be specific to the rural communities that you serve, such as Mount Airy?
Yeah, we do have, I think that those challenges are pretty broad. They're going to affect most of our patient population. And those are things typical to rural communities. So there are transportation issues. We don't have public transportation, we don't have buses and things like that. So patients do struggle at times with that. We do have some options in the community that our social workers help to connect patients to. And then financial, that's kind of related to transportation, is financial issues, especially over the last few years with the economy the way it is, and inflation, and grocery prices are high and fuel is high. And so patients struggle with just making their copay sometimes, or they may be out of work. So those are the types of things that we see. We do see some educational limitations. That's not just specific to Medicaid. That's kind of across the board in rural communities. And so not just, scholarly education, but health education, understanding the importance of taking your medication every day instead of, trying to ration that because of cost. It can really lead to negative outcomes. And so we do a lot of education. That's part of that communication piece, educating patients about the importance of seeing their primary care doctor, or, taking their medications regularly, or just how to take care of themselves at home so that they can stay where they are the healthiest and the happiest.
That's good stuff. Well, tell me, Emily, what's working well so far? And maybe what are the biggest operational or data challenges in implementing this program, and how did you guys overcome that?
So I'll start with the biggest challenges. Because we're a small hospital, we have less than 1,000 employees. And so we don't have a lot of the resources right at our fingertips that we need to implement a large care coordination program. So data definitely is huge. We can see when patients access our organization, and we do have access to information from other surrounding hospitals. But really getting all of the information about our patients' access to care from all of the places they go is a big challenge for us. And I know it is for other hospitals as well. But what has worked really well for us is to partner with CHESS and be able to access a larger network of resources. So, CHESS helps us to gather data, helps us to kind of aggregate that, to know what that data means to us and what we can do with it. And then having access to just more people to do the work, us trying to utilize one or two people to call all these patients proactively, to help them get their appointments scheduled, or to make sure they keep them. It is almost an impossible task for us to do on our own without a partner. And so that has been our biggest help. That has worked more than anything else, is partnering with somebody who has some resources that we can utilize to help our patients.
Well, is there anything that you want to call out that's working well, or would that be a combo response?
Well, I think I would say the proactive outreach for patients. So meeting them where they are, being able to contact patients in their home. And that's one great benefit of care coordination, is sometimes patients don't feel connected to their healthcare. They only see their provider maybe once a year, or they might have an emergency department visit. But all of that time in between, they may not know, am I taking this medicine right? Or should I be feeling this way? Or how can I get better access to my medication? So those kind of things, I think being able to contact patients in between visits, manage not only their, strict clinical care that they're receiving, but help them with all of the other things that affect their ability to remain healthy. That is what's working, I think, the best for us, is being able to reach patients in that in-between time.
Outstanding. How does managed care under Medicaid affect how patients interact with providers? You just talked about how they seem a little disconnected with their health care, and I see that. I feel that way a lot of times. I'm not quite on the Medicare bandwagon just yet, but I'm getting there. So, compared to traditional Medicare, how does this work under Medicaid?
So I think it's a little bit different for Medicaid patients. There's a lot of focus on Medicare in our country. We hear a lot about Medicare beneficiaries and here's what you can access, and there's a lot of programs. And so we're starting to see that happen in the Medicaid realm. And a lot of times we just think about Medicaid applying to pediatric patients or, unemployed patients. But the reality is there's a huge population now with Medicaid expansion of folks that you work with, that you shop with, that you go to church with, who have Medicaid. And so all of those benefits that we have seen available to Medicare patients, they're going to be a little bit different in the Medicaid population here and there. But I think all of those things are now becoming available in the Medicaid population to really reconnect them with their provider. So that becomes true in, like I said, in that in-between time, between your visits with providers. Someone is reaching out to say, how's everything going with your physical therapy? Or, did you get the durable medical equipment that you needed? Did you get your nebulizer machine? Are you getting your oxygen? Were you able to pick up your medications, or did they get delivered from the pharmacy? So it's just someone having a little bit of an in-between check, kind of see what's happening with those patients. And then even for issues like loneliness, there's a care coordinator who's going to reach out and call them probably every month and touch base so that they can kind of just be a point of contact, so that the patients know, I don't have to do this by myself. I don't have to try and figure it out by myself. And if I have a question, I have somebody to call.
Yeah, that loneliness is something that I don't think gets talked about near enough. Well, tell me what strategies you found that have worked best for provider buy-in for care management, because clinical time's stretched so thin, and nobody has time to do everything throughout the day. Does this seem like a hurdle for your providers, or is it something that seems to be widely accepted or gaining momentum?
So this is something I'm really excited to see emerge because we have seen it with Medicare, with our Medicare patients. And so you are right. Providers are stretched just like the rest of us. There's pressure to keep clinic running and get patients in and out and increase volumes and all of that kind of stuff. And so having an intermediary like a care coordinator is really helpful to providers, because they can keep their clinical day going knowing that the care coordinator is touching base with patients. They're going to alert them to an issue. They'll come to them and say, hey, so-and-so is having difficulty with this medication. They have a side effect. What are the options? Can we switch it to something else? The provider can give that feedback that takes just a short amount of time, and then have confidence that the care coordinator then will take care of it with the patient. They'll finish the rest of the process. And so, they can pretty quickly resolve issues that, if they were left to do that by themselves, would take a ton of time that they just do not have. And then that care coordination hopefully keeps patients out of the emergency department. We can avoid an inpatient admission or some, oftentimes a really terrible consequence just for one small thing that the care coordinator is able to take care of. So it's it goes right back to team-based approach. The more people you have to help, the easier it is to take care of patients.
Well, that's great. Emily, we're coming up on time, and I was hoping that you could stick around for a few minutes so that we could continue this conversation.
Sure, happy to.
Great.
This has been the Move to Value podcast, powered by Chess Health Solutions. We hope you have enjoyed this episode. If you would like more information about this and other episodes, you can head over to movetovaluepodcast.com to check out all of the available resources. If you're interested in continuing to hear about value-based care and how it impacts you, you can sign up for our email notifications or subscribe to this podcast on your favorite podcasting platform. Also, we would love it if you would share the Move to Value podcast across your networks and leave a rating or review. Thanks for listening.